Tonight, sobering statistics here in Ohio. You can see in just the past 3 weeks how dramatic the increase is in the amount of cases we're seeing per week. And it is only going up when you take a look at our 14-day moving average. Now, as we try to get this virus under control, a vaccine is on the horizon.
Tonight, 10 TV's Bryant Somerville talks to a local expert who says a turnaround of less than a year for a vaccine is unprecedented.
After 8 months of a pandemic and a solid month and a half of hearing of a possible vaccine, Governor Mike DeWine announcing Tuesday a date.
Looks like around December 15th, we will get our first batch. And we're very excited about that, or in the process of planning how that will get out.
DeWine says the first batch, assuming it's approved, will be from Pfizer. The second batch, a week later, would come from Moderna. The vaccine will take 2 shots about 3 to 4 weeks apart.
The good news now, Brian, is the light is on at the end of the tunnel.
Dr. Frederick Bertley, a president and CEO at COSI, has a PhD in immunology. He studies how viruses make us sick and vaccine development.
Never in the history of vaccine development have we put so many scientists and spent so much money to try to develop this.
He says what makes the coronavirus vaccine so impressive, the collaboration, locally, nationally, internationally. He also points out scientists were not starting from scratch, being able to look at other respiratory viruses as precursor candidates helping to develop these vaccines. And FDA-approved clinical trials, usually separated into 3 phases, were blended, helping to expedite the vaccine. Now, he understands some people might be hesitant for this vaccine, but he is not.
Would you feel safe taking it once it comes out?
Man, I'm first in line.
He also wants people to know the FDA assembles experts from around the country to examine carefully the data from companies like Pfizer and Moderna, to study it and make a decision to release it.
People who are worried about government pressure and, they're just going to prove it to fast track for political reasons. These are men and women like me and you that have nothing to do with the FDA or are not working for the government, but are experts in this area that are going to say yay or nay.
The state's distribution plan is expected to put a high priority on first responders like healthcare workers and nursing home residents and those considered high risk for COVID. With limited amounts available at first, Dr. Bertley says it could be next summer before it's available to the general public. But he says the fact 3 months ago there was no timetable for a vaccine, and now that one is expected in the next 3 weeks, that is something to be proud of.
More than ever, this should make society wake up and say, you know what? Science is really cool.
In Columbus, Bryant Somerville, 10 TV News.
Now, in order for the FDA to give emergency use authorization, it must first have to receive an application. Now, it requires at least 2 months of safety data, and a panel of outside experts offer their opinions. The goal here is to have a vaccine both safe and effective.